Hi everybody, it's Michelle from Virtual Hand Care, your online hand expert. Today I wanted to show you a quick taping technique for your thumb. So if you have pain when you are pinching or holding things, picking up things, holding a book, opening a jar, and you get this sharp shooting pain at the base of the thumb, it could possibly be an indication of some osteoarthritis in the thumb. And that can be very painful and it can prevent you from using your hands. So I have found over the years a very simple taping technique that can really help take the edge off of that thumb pain. It helps with the positioning of the thumb. With arthritis in the thumb in particular, you start wearing away at the cartilage and the surfaces in the thumb, and it also can lead to deformities. So this taping technique can help actually assist it with being placed in a little more comfortable position. We're not looking to force the thumb back into its normal position because that isn't necessarily what we're looking to do. And everybody's arthritis can be in different stages, so it's never good to force the joint to go back. However, there are things that we can do by gently helping to place it there and then doing some simple exercises to provide stability to the thumb so that you have more function and pain-free use of that thumb. So you want to start with a roll of kinesio tape. I will put a link in the comments below of where you can find the tape. For this particular taping technique, we're going to cut about 3 to 3.5, depends on how big your hand is. And then what you would do is cut it long ways, so you end up with a thin piece. So then what I do is I curve the edges with scissors because that will help it stay longer. You want to make sure that you wash your hand really, really, really good. That will help with the tape sticking on your skin as long as possible. Now what you do is you want to tear off the backing about 1 inch or so from the edges of the tape. And that keeps it from sticking to itself. Now just take one piece of backing off. You're going to place that piece on the palm side right at the base of the thumb here. So I've placed mine right about here. So it's right around the base of the thumb. Then you take that next section off. Now what you do is you want to bring your thumb out. So what you're trying to do is get a little bit of muscle going right around the thumb. So you're not straightening the thumb up. It's not out or up like this. It's actually more down. So you're kind of like have a nice C position. We're trying to keep this nice web space of our thumb. So you take the tape, stretch at about 50%, and you're looking to go around the thumb muscle. So keep that C, go around the thumb muscle and through that web space. And then you've got the tape coming around the back, making sure that the tape has surrounded that thumb muscle and gone into the thumb web space. And then what you do is just pop that last little piece off, and you're just anchoring it down along the base of the thumb into the wrist. And if it goes a little long, that's okay. And then you want to rub it in there to help activate the glue and get that to stay. Now, what you should be able to notice is the thumb should feel a little more supported, and you should notice a little bit of less soreness when you are holding things, pinching things, carrying, holding a book. That is a good indication as far as if this taping technique is right for you. And if that's the case, this is a good indicator that some simple stability exercises may be helpful for you. Contact me at virtualhandcare.com and I'd love to help you with a few simple exercises to help with your thumb pain. Now, if you notice that this does help, but you don't want to keep taping because maybe you have some hair on the arm and it hurts, or your skin is getting irritated, which by the way, this is latex free. But if you notice that you're just not wanting to tape all the time, if this particular taping method does help you, then it's a good indicator that a splint or a little soft brace like the one that I have here. And this one goes on the thumb and wraps around, and again, comes around the thumb, very similar to what we did with the tape, and then comes through the muscle, through the web space, and down into the back of the thumb. So you can see that it does some similar things like the tape does. But if you don't like the feel of having a brace on your hand, then I would do the taping technique, or vice versa. If you don't want to tape all the time, try the brace. And I'll put a link in the comments below of where you can find both the tape and the brace. So I hope that helps you. Like this video and subscribe to virtualhandcare.com. Thanks for watching.